Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. As we know, we were discussing about recessive trait of disorders, and in that we are looking into autosomal recessive disorders. In the first class, I have given some of the basics related to autosomal disorders, and we have also seen one family tree or pedigree. So how actually autosomal disorders comes. The basic rules are very simple. Number one, autosomal disorders usually skip the generation. Disease suddenly appears in the family after many normal generations. Number two, male and female ratio is equal. Carrier ratio is also equal, and most commonly seen in case of consanguineous marriage. Otherwise, there is chance of a recessive disorder is very less and remote. Now look into, this is one possibility that we have seen in the last class. Now we will see another possibility in case of recessive disorder. What is that? Suppose if both the parents are carrier. Okay, both the parents are carrier. Now see, suppose male, she is a carrier for a recessive disorder, and female is also carrier for the recessive disorders. Then what happens? Then the possibilities are this, that the disease will be 25% out of the 4 kids, one will be diseased, and out of the 4 children, 50% will be carrier and 25% will be normal. So this is the possibility when both the parents are carrier. Both the parents are carrier. In the last case we have seen only one parent is carrier. When the one parent is carrier, then there is no disease in the next generation at all. And when there is an interfamilial disease after so many generations, then suddenly the disease appear. Okay, this is one possibility in case of a recessive type of disorders, autosomal recessive disorders. But here, suppose both the parents are carrier. Okay, both the parents are carrier, just as it happened here in this family. So both the parents are. Then what happens? 25% disease, 25% normal, and 50% will be carrier. This is almost the same thing. Now come to the another part, that is affected individual mates with the heterozygote. Now what is that? Affected. One person is there. That means female. She is already diseased. She is already having a recessive disease. Okay, and she is marrying with a normal in the sense she is marrying with a carrier. He is no heterozygote. Heterozygote means he is a carrier. Male is a carrier and female is deceased. Then what is the percentage? In such conditions, 50% will be affected. 50% will be affected, and out of the 50%, one will be 50% male and female ratio will be seen. One will be male, one will be female, and rest of the 50% are again carrier. Again in the carrier also one will be male and another will be female. 50-50 ratio is maintained, 1:1 ratio is maintained, and there is no normal. So when an affected male, a carrier male mate with an affected female, diseased female, and this is the possibility in case of a recessive disorders. Okay, so in the clinical practice, in general public, we can come across with any conditions, isn't it? Now another condition where both the parents are diseased. Suppose both the parents are diseased, male is also diseased, female is also diseased, both are having some recessive problem. Now what will be the possibility? If they have 4 kids, all the children are get affected. All the children are get affected. So this is one of the 3 or 4 possibilities which we see in case of autosomal recessive disorders. Now, once the new mutation developed, it takes many generations to develop the disease. This is the beauty in case of recessive disorders. If suppose a new mutation developed, suppose, okay, in dominant disorders we have the concept of new mutation. Such new mutations, when happens in the autosomal dominant disorders, immediately it manifests the disease, isn't it? But in recessive disorders it is not like that. Suppose a new mutation developed, it takes many generations to develop. the disease. Once the new mutation developed, it takes many generations because it is a recessive gene. Single gene cannot manifest any disease. It has to get another recessive gene, which is a carrier. Then only the both will be carrier, then there will be disease. So it takes so many generations to develop the disease. The carrier mutant gene has to travel many generations, and if there is no consanguineous marriage at all, then the risk is very, very minimum. Again, it takes many generations. When there is a possibility, a new mutation developed, okay, there is no consanguineous marriage at all, then there is no manifestation of the disease. New mutation developed, there is some consanguineous marriage, so then there is a possibility. Okay, so risk is more in consanguineous marriage and risk is very high in incest. Incest means marriage or mating with the very close relatives, first degree relatives, like that. Okay, so now in such conditions the risk is more. Okay, so transition which is seen in case is horizontal transmission. Okay, now in autosomal dominant and recessive, the male and female ratio is always equal. There is no confusion at all, as the autosomes are equal for male and female. New mutations if occur, it takes many generations to develop. Now, before going to this, what Ayurveda says about this is, if you study Ayurvedic classics very carefully, there is very clear message that Sagotra Vivaha is contraindicated. You should not marry, you should not have sexual intercourse with the male or female of the same Gotra. Now you can ask, what is this Gotra? Gotra is something different from the family. Okay, Gotra means in Indian philosophy, we believe that we are basically belongs to the different Gotras, and these Gotras are given the name of different rishis. Therefore, we call it as Rishi Mula. Okay, there is Angirasa Gotra, there is Bhargava Gotra, there is Bharadwaja Gotra, there is Vishwamitra Gotra, Kashyapa Gotra. Okay, so like the different Gotras are 8 or 9 Gotras are mentioned. Every individual, especially in Indian continent, especially Hindus, every individual belongs to one particular Gotra. Okay. Now, that Gotra contains the DNA or whatever the chromosomes of that particular family tree. Okay. Maybe thousands of generation previous. Okay. Thousands of generation earlier thousands of generation, the genetic information has been carried through. Okay, now Ayurveda says to prevent this autosomal recessive disorders, one simple formula. What is that? Don't marry between similar Gotra. If you are marrying with the lady or male or female of the same Gotra, then there is every chance of getting a carrier gene if at all it is present. Isn't it? But if you are marrying with the girl or boy of the different Gotras, then this possibility has gone. Okay, so therefore, Sagotra Vivaha Nisheda, Agotra Vivaha should be done. When you select the male or female, it should be of Agotra, it should not be of Sagotra. So this prevents maximum autosomal recessive disorders. We know that maximum genetic disorders, 90% of the genetic disorders are autosomal recessive disorders. And once the disorder comes, definitely the carrier gene or the disease will carry in the next generation. So we have to take the precaution. One of the best precaution taken by Ayurveda is Sagotra Vivaha is contraindicated. You follow very simple rule. No marriage between the lady and male and female of the same Gotra. That's the importance of looking at the Kundali or Jataka. When you look at the Jataka, you will see which Gotra he is. Again, other points are also seen in Kundali. It's a type of genetic counseling actually. Ayurvedic Indian method of genetic counseling. Anyway, that we'll see later. Here a simple rule gives a very qualitative society. In the society, what happens? The citizens' quality will going to increase. Otherwise, we will have a lot of people with these genetic disorders. It cannot be considered as a qualitative society. One of the simple rule mentioned in Ayurveda that helps a lot to produce a qualitative society and also decrease the prevalence of the genetic disorders. Of course, this rule is only applied for autosomal or sex-linked recessive disorders, not for the dominant disorders. They come in each and every family. You cannot prevent it. Of course, their number is also less, only 10%. But the recessive disorders are more. So one of the best way of prevention is simply follow Sagotra Vivaha should be contraindicated, Agotra Vivaha should be done. That's a simple rule. Now these are some of the common autosomal recessive disorders. Okay, deafness, okay, sickle cell anemia, homocystinuria, albinism, we see many cases, beta thalassemia, Friedreich's ataxia, Wilson's disease, cystic fibrosis, phenylketonuria, all maximum are metabolic disorders. See, hemochromatosis, hereditary emphysema, alpha antitrypsin deficiency. Okay, so these are some of the common autosomal recessive disorders. Of course, in the autosomal recessive disorders, there is another concept called as locus inheritance. Inheritance, that's a very interesting, actually, it will take some time to understand, but very interesting phenomena of locus heritability in autosomal disorder, that we will see also in the next class if possible. Okay, so with this we conclude. This is all about the recessive disorders. I hope you understood the basic concepts of recessive disorders. Thank you very much, and we will meet again. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.